All right, we're going to talk about this subject called occipital side slip. What's an occipital area? The occipital bone is the one at the base of your skull. Side slip, it's slipped to the side. What happens if the base of your skull has slipped just a little bit to the side and the hole at the bottom of your skull that your spinal cord plugs into is now being pressed upon? Well, you get a nerve shutdown, relatively speaking, at the base of your skull in the most pristine and perfect and important area of your nerve system in many ways, because it serves your brain, and all the connections of your brain and body have to travel through that, virtually every one of them. So this becomes a huge chiropractic problem that most people don't know how to resolve and isn't even treated well in most chiropractic techniques. When the skull has slipped slightly off to the side, it has very far-reaching effects. The founder of muscle testing of our field of applied kinesiology, where we use muscle testing to find things, Dr. Goodhart, discovered that you could tell a person had pressure at the base of their skull by testing their hips, if you can imagine that. It affects things so far afield that it actually shuts off hip power, and that's how we know you have pressure on the brainstem area at the base of your skull from a side slip of your occipital bone. We will test your hip in what are called psoas muscles. Bring the leg up and out to the side a little bit, push down and out. We find they're dead weak. If they're weak on both sides, you can bet money you have got an occipital side slip. This is something we have to check on every patient because it's a very common problem. And I've often said if I had only one technique, that I was limited to only one thing I could do chiropractically for the rest of my career and had to pick one only, this would be it, correcting occipital side slips. Why? Because it affects so many different things: headaches, migraines, low back, hip problems, other nerve failures, arms, hands, heart. I can tell you cases that are so remarkable. I had one patient, she was in a coma, and she had gone into something called sepsis, where her blood had gotten so infected they had put her in a coma, and when she came out, her arms and hands were paralyzed. She couldn't move them. She couldn't walk. They had to bring her in a wheelchair. It took 4 people to lay her down on my chiropractic table. Couldn't use her hands, couldn't use her fingers, couldn't walk, and her vision was, everything was double. So her daughter, who was one of the people that helped me bring her to the table, she was seeing her in double. I found she had an occipital side slip. I had already been treating her very low adrenals with a supplement for a few days, but never touched her. And on this day, we moved her occiput. It's a very unique adjustment. You have to adjust the occipital bone when it's a side slip from the side. Unlike most chiropractic, which is done with rotation, this one is right across, straight from side to side. I moved it. Suddenly she went, "Oh, there's only one of you," as she looked at her daughter. She moved her hands. She was able to stand, and on the way out, she pushed the button on the elevator with her hands that had been paralyzed for weeks. That's the effect of this one. I had one remarkable patient who was sent to me by the president of the American Midwifery Association who had toxemia of pregnancy. Her blood pressure was to the moon. Her ankles were so swollen, she said if she took her shoes off, she'd never get them back on again, and she hadn't peed in 3 days. I found she had an occipital side slip. I moved it. That took a fraction of a minute. What, a second, 2 seconds to actually do the job? Probably a second. She ran to the bathroom, peed, got back in her shoes. We retook her blood pressure. It was perfect. Later, the problem recurred as the pregnancy went to the end, and I was invited to stay in the hospital room as the baby was to be delivered and during labor. And they had her on a fetal monitor that was measuring the baby's heart rate. And the heart rate would be going 142, 139, 137, 128, 141, 138, 71, 21, 0, flat line, and the baby was dead. "Arlo, come over here." And they called me up where I was sleeping in a chair, and I moved her occiput, and the baby kick-started in the moment. The heart went from 0 to 50 to 90 to 140, all in that moment. I had to kickstart that baby as it died in the womb 3 times by moving the mother's occipital side slip. Talk about a miracle adjustment. And that baby was born perfect absolutely fantastic, absolutely healthy. Mother absolutely healthy. This is a very high-risk pregnancy problem that was completely resolved by fixing an occipital side slip that had to be done a few times. Toxicity can cause occipital side slip. And in this case, it was the toxemia of pregnancy that was the toxicity occurring, and the occipital side slip was actually causing problems in the brainstem that were affecting the chemistry of the body, because that's also under the control of this lower area of the brain. I check it on every patient, and it comes up remarkably frequently, and when it needs fixing, don't fix anything else first other than kickstart their adrenals if they're too low, and then get right onto the occiput. Anything else that you're going to fix in the nerve system in chiropractic, if this one is out, you are not going to get success fixing the arm, shoulder, hand switchboard for a musician with hand problems, the hip and low back and sciatic problem for a person who's got a disc injury. When the occipital side slip is present, it has to be fixed because it affects things all the way down to the toes, and we actually test it through the hips. If you can imagine the short circuit up here, we find the proof of it right down in the hip system. This is an incredibly important adjustment, an incredibly important tool in my toolkit, and if I had only one tool, this would be the one I'd pick, because it has helped resolve so many different kinds of nerve problems, from nerve problems to the heart, nerve problems to the brain, nerve problems to the head, nerve problems to the eyes, restoration of vision to people who have lost vision, restoration of hearing to people who have gone deaf. All of those have required the correction. I have patients who have required the correction of their occipital side slip in order to get anything else fixed. From there on down, you better get the top in first and get it right.